Okay, so as I mentioned, insulin resistance and glucose and lipid metabolism. This is a condition in which the body tissues do not respond to the action of insulin. It's due to the insulin receptors that are unresponsive to the action of insulin or are insufficient in number. Most insulin receptors are located on skeletal muscle, fat, and liver cells. When the insulin is not properly used, the entry of the glucose into the cell is inhibited. So this results in hyperglycemia. In the early stages of insulin resistance, the pancreas responds to high blood glucose by producing greater amounts of insulin. So for a temporary state, there is hyperinsulinemia and hyperglycemia. A second factor in development of type 2 diabetes is marked decrease in the ability of pancreas to produce insulin. So the B cells become fatigued from compensatory overproduction of insulin, and the underlying basis for the failure of B cells to adapt is actually unknown. However, it may be linked to the adverse effects of chronic hyperglycemia or high circulating free fatty acids. A third factor, inappropriate glucose production by the liver. Instead of properly regulating the release of glucose in response to blood levels, the liver does so in a way that it doesn't correspond to the body's need at that time. But it isn't the primary factor in the development of type 2 diabetes. And the fourth and last factor is the altered production of hormones and cytokines by adipose tissue. They're considered adipokines. They appear to play a role in glucose and fat metabolism. They contribute to the pathophysiology of type 2 diabetes in a way that the two main adipokines believed to affect insulin sensitivity are adiponectin and leptin. Individuals with metabolic syndrome are at increased risk for the development of the type 2 diabetes. Metabolic syndrome is a cluster of abnormalities that act together to increase the risk for cardiovascular disease and diabetes. It's characterized by insulin resistance, high levels of triglycerides, decreased levels of HDLs, increased levels of LDLs, and hypertension. Risk factors for metabolic syndrome include central obesity, sedentary lifestyle, and certain ethnicities like Native Americans, Hispanic, and African Americans. And that's all.